docket, they will be on the docket for Thursday morning. Additionally, looking at the clock, the committee has about an hour and 10 minutes, which we'll be able to work this morning. Subcommittee will rise at approximately 11. Any matters not heard this morning will be on the full docket for Thursday morning. We will complete our workload Thursday morning. If it appears that we're going to need extra time, stay tuned, sports fans. We might be meeting as a full committee earlier than 8:30. I think you would prefer that rather than us scheduling a special meeting Thursday evening or Friday. Yeah, we would. Any patrons who have bills that they would like for them to go by for the day, we're fine with that, but do understand Thursday we're playing cleanup. How I will be proceeding this morning is first, where there are patrons in the audience, where bills have not been heard in subcommittee, we will take them first. Additionally, when we get to subcommittee reports, if a bill was heard in subcommittee, we will not be taking testimony from the patron or the public unless it's something different or you were unable to be at the subcommittee level. We will be acting upon the subcommittee chairman's explanation of the matter and recommendation and going from that point forward, which is the normal practice. For those in the audience, if you're new to this process, the short session, the trains run faster because we've got fewer days to get it all done. Just kind of, are there any general announcements from the committee as we're still waiting for staff to play catch up, and they're doing a great job of trying to get there? All right. Members should have all substitutes recommended from subcommittee distributed before you physically or electronically. Also, just as a general announcement to the committee, please use your request to speak button if you want to get my attention. Yes, Delegate Duff. Photoshop can make you look better. Okay. All right, committee, we are going to take one matter up, and we're not going to hear the bill, so we don't have to have a recorded vote on the matter, but there's no recording. Committee members, if you could give your attention to House Bill 2304, it's my measure, and what I would ask the committee's indulgence to do if we could adopt an amendment nature of a substitute on the matter. And then I'm going to ask for the bill to go by for the day. The reason for that, it is a very extensive list of enactment clauses. By having it go by for the day, it'll be out there for public purview. And so then when we consider the matter on Thursday, the public will have had about 2 days' notice if there are various changes that need to be made to the matter. And then even at that, on Thursday, when it does come before us for discussion, it will need to go to appropriations. Always have fun. Okay. So subcommittee, for committee, without objection, will adopt the amendment nature of substitute for House Bill 2304. Hearing no objection, it's properly before us. Without objection, the bill will go by for the day. The bill goes by for the day. Also, at this juncture, I want to thank all the stakeholder folks. We had fun last Thursday. But they did yeoman's work trying to come to mostly a consensus agreement, and that's the matters that get before. So is staff ready for us to act on this? Okay. Okay. Do we have patrons who have bills that have not been heard at subcommittee? All righty then, let's go ahead and start with subcommittee 2. Delegate Bell, if you could present your report. And I will tell patrons of the subcommittee there are a number of measures that I have received a letter. And so be a factor in the motion, I'll let you know before the committee actually acts upon it.
Mr. Chair, 1483 Delegate Bill involved Board of Behavioral Health and Developmental Services Amendment certain regulations. Now, Dickie, is this the one that we have an amendment to, a line amendment?
Mr. Chairman, yes, it
I
is.
think it's a technical line amendment that we need to make sense of these substitute from the thing. The first step, Mr. Chair, is I would ask you to adopt the substitute.
Without objection, the substitute will be properly adopted. Hearing none, that's now properly before us.
Mr. Chair, I understand that the patron has a technical line amendment he wants to make before we take it up.
Mr. Chair, the amendment is on page 1, line 11, after qualified mental health professional adult, insert qualified mental health professional child.
Without objection, we'll adopt that amendment. It's properly before us.
Mr. Chair, it was the recommendation of the subcommittee to recommend reporting 9-0, and I so move.
Any questions on the motion to report as amended 1483? Anyone in the audience to be heard on the matter that was unable to be at subcommittee? I love requests to speak. They have, thank you, David. Yes, sir, question?
Right, yes. Just wanted to ask, why do we need this section of the bill? And is that something we get paid for private services? Is that why we're doing that?
Mr. Chair, that patron is here, I'd ask.
Delegate, Dick Bell, you want to address the question?
Mr. Chairman, I'm going to ask Mr. Jamerson if he's still here to.
Never mind, I will go.
Okay, the question has been withdrawn. Any other questions or comments before the committee takes action? Any members record your vote on the board on the motion to report as amended with substitute 1483? All members voted to care to be recorded. The bill is reported 22-0. Delegate Bell.
Mr. Chair, I'd like to next take up 1548, Delegate Farrell.
House Bill 1548.
Mr. Members of the panel, this involves the how you handle advanced medical directive for mental health. And it requires a very narrow carve-out, but it says that when the advanced medical directive says that we will appoint a person to make the decision for me, and the only issue is whether the person shall be placed inpatient, if you will, that we've made, we've shortened the list of people, then we will have to decide if the person is in a position to make a decision. We went around and around on this. It was I think, started bigger, but this is the bill that we have. It was the recommendation of the, I'm sorry, excuse me, Mr. Chair, the substitute, I move this up.
Without objection, we'll adopt substitute House Bill 1945.
Mr. Chairman, the substitute in place, it was the recommendation of the subcommittee to report the substitute 10-0, and I so move.
All right. The motion is to report 1548 as amended, and with audience be heard on the matter. Questions or discussion from the committee? I'm going to report your vote on the board on the motion to report. Delegate Bell?
Mr. Chair,
No, the other Delegate Bell. See nothing? Okay. All right, bill is reported 21-0. Delegate Bell?
okay, Mr. Chair, I'd like to next take up House Bill 1945.
1945.
This was with Delegate Peace, and I tell the subcommittee members, you might recall this is an expansion of the definition of adult exploitation. We were sort of running out of time. We had a discussion with the patron about whether it would include simple harassment, and he was able to confirm that it did. And so there's been one small change to the bill that you saw, which would be to take out the harassment part, but all the other language is there. And there's a substitute, Mr. Chair, so I would ask that we report this up.
Without objection, the amendment nature of the substitute is before us and properly adopted.
And again, underlining for those in the subcommittee, we had that issue about harassment. This is the change since what you saw last, that it's taken out the harassment language. With that, Mr. Chair, I would recommendation of the subcommittee to report and refer 8-0, and I would so move.
Questions from the committee on the motion to report and refer?
Mr. Chairman, I would just add, as the patron, thank Chairman Bell for his time, that the substitute would eliminate the fiscal impact, but certainly we'll work through the process in the night floor and expect to see that again. Thank you.
Mr. Chair, I don't, we've got the letter, do we not have the letter yet?
We do. Committee members, record your vote on the board on the motion to report and refer to appropriations. The bill is reported and referred 21 to none. Delegate Bell.
Mr. Chair, the next one up is 2002. This one is not unanimous. I'm looking for my draft from staff. I don't have a copy of the bill. Okay. Mr. Chair, this was Delegate Poindexter. They're required the reporting of non-identifying information for refugees and immigrant resettlements by locality. And it was a fairly long debate, but it was not unanimous. It was, the motion report was 7-3. I see the delegate is here if anyone has any questions, but I recommended the report. It was 7-3, the recommendation was to report, and I so moved.
And no amendments, correct?
That's correct.
Discussion from the committee on the motion to report House Bill 2002. Testimony from the public that was unable to be at subcommittee level. Committee members, record your vote on the board on the motion to report House Bill 2002. Delegate Feast, do you care to be reported on that? All members vote to care to be reported. The bill is reported 11 to 10. Delegate Bell.
Mr. Chair. Mr. Chair, if we could do, and I'll ask the staff, I gather the only bills I have copies of are the ones for which there was a substitute. Is that what's happening? That's okay. Mr. Chair, I'd like to look at 2156.
House Bill 2156.
So Delegate Rasul, the issue was we have some state agencies that provide child care. So you have issues like at Virginia Tech where they provide it for their employees. Well, we have some fairly extensive regs in how you handle it, as you knows, these for non-government agencies. When they have one, it raises different issues. And our goal was to put them in the same posture as best we could. And so you'll see that it involves a new definition for a person who operates and maintains a child welfare agency, and it can thereby include the, if you will, the state-run, or those child welfare agencies that are run by state agencies. In any case, it was a
The substitute to the bill that was adopted in subcommittee removes all of the adult facilities, limiting this only to child welfare
There's
agencies.
another guy down, I didn't, in fact, and Mr. Chair, I got it backwards. I would ask that we adopt the sub.
We have a substitute for 2156 without objection. Will adopt the substitute recommended by subcommittee.
Mr. Chair, all of the comments I made are only directed to the sub. I apologize. It is now the recommendation of the subcommittee to report the substitute 10-0, and I so moved.
Questions on the motion to report as amended 2156? No others heard on the matter. Committee members, record your vote on the board. Motion to report as a substitute. Yes, ma'am. Do you have a question? Or?
I just wanted to make a comment.
All right. Were you able to be at the subcommittee?
Yes, sir.
Okay. Clerk will destroy the roll. Yes, ma'am, please.
Apologize. My name is Jessica Chairman. I'm speaking on behalf of VCU Health Child Development Centers, as well as other university-sponsored centers in support of this bill. As institutions of learning, we feel it's important that we have access to and are accountable for meeting health and safety standards required as part of Virginia state licensing. As models of high-quality early education and best practice, we feel it's important not only to be aligned with Virginia state licensing standards, but also to have the opportunity for verification of meeting those standards.
All right. Thank you, miss. Any questions? All right. The motion is to report as amended. Members, record your vote on the board. Bill is supported 21 to 0. Delegate Bell.
Mr. Chair, ask us to take up 2213. This was Delegate O'Bannon. This was not unanimous. Mr. Chair, this bill would reduce the total lifetime limit on TANF to 24 months, and then the consecutive month, which is currently 24 months, would be reduced to 12 months, and reduces the time period of ineligibility from 24 months to 12 consecutive months. It was the recommendation on a 6 to
good morning. My name is Katie Lambert Thompson, and I'm a clinical social worker at Family Lifeline. We are the largest nonprofit provider of intensive home-based services in the central Virginia area. I wanted to just quickly say that our opposition to this bill, as a clinical social worker, I work with many clients who have mental health problems, who are working and struggling with mental health. I work with a client who has taken at least 14 months to stabilize her due to her extensive trauma history. And so being in the VIEW program has really allowed her to provide for her family and provide a sense of self-esteem and worth. And it's really important that she has longer than a year, as it's taken, as some people have extenuating circumstances in regards to mental health that take a long time to stabilize and treat. So I just wanted to put forward that in regards to that.
Thank you.
Thank you.
And I see others coming forward. Again, if you were able to be at subcommittee, we ask that you not come forward. But we do want to give the public full access to the process. So if you weren't at subcommittee, come forward. Understand, we're pretty familiar with the issues, I think, of the well-being rate.
Good morning. My name is Sandy Smith, and I'm with the City of Richmond. We have a program called BLISS, Building Lives to Independence and Self-Sufficiency, and I wanted one of the young ladies who is participating in our program to speak upon what this bill will do with those who are still trying to get these benefits.
All right, please.
Hi, I was here last time. My name is Aisha Walker, and in a program benefited me and my children. Poverty is real, and the program does help. Sometimes it takes longer than 12 months for a person to become self-sufficient. That's all I have to say.
Thank you, Ms. Walker. Yes, ma'am.
My name is Vicki Cruzy. I'm here actually today speaking on behalf of the TANF View Committee for the Virginia League of Social Service Executives, as well as the Virginia Association of
And your
Local
name?
Human Service, Vicki Cruzy,
Thank you, Ms. Cruz.
and the Virginia Association of Local Human Service Officials. And we just want to reiterate the very many barriers that our participants face when they come into the TANF program. We already heard from someone speaking to the mental health issues. We have people from all walks of life, single and two-parent families who've lost jobs, exhausted unemployment benefits, single moms escaping domestic violence, individuals with mental health learning disabilities, those who come in who are homeless and in transitional housing, many who need assistance with transportation, childcare, GED, and training to get better jobs. This is very important. Virginia was one of 5 states that experienced the largest relative employment losses for low-skilled workers. After the Great Recession, an 11% net decline, about 12% of the state's population lives in poverty, and of course we know that research shows a strong relationship between education attainment and earnings. With the Governor's New Virginia Economy Initiative that has greater emphasis on education, training, and credentialing, we need the opportunity to work with individuals first to remove barriers so then they can get to the point where they can engage in education and training and raise their standard of living. This is important because our reports show that 61% of the individuals in our VIEW programs are working, but their average wage is only $8.86 an hour, and 19% of them work at less than 30 hours a week. This puts them at very high risk. In addition, we're way overdue for TANF reauthorization at the federal level. One of the criticisms and one of the things that have been suggested at the national level is that there be a minimum number of months that states must provide TANF put into legislation, so we actually see this as being precipitous until we see what happens at the federal level. Finally, the TANF numbers are already declining. Welfare reform's been in place since 1995. The numbers continue to decline. We don't see the need at this point in time for there to be any change to this. So we would just ask that this bill not be put forward.
Thank you, Ms. Cruz. The others to be heard on the matter from the public. Many members, the subcommittee recommendation is to report and refer to appropriations 2213. There's no, I love requests to speak. This is like, okay, if it doesn't light up, it ain't on. It's funny enough. Okay, yes, sir. No, it's sir.
Just wanted to speak to the bill. So as everybody knows, we have a 5-year lifetime limit. Now,
Further discussion on the motion? Members, record your vote on the board on the motion to report and refer to appropriations 2213. All members voted who care to be recorded. All right. The bill is reported and referred to appropriations 1211 to 10. All right. Delegate Bell.
Mr. Chair, 2279 is Delegate Hester, and the issue was when CPS gets a complaint involving a member of the United States Armed Forces, they currently only bring the armed forces in at the end of it, and what we discovered is that there's a lot of information the armed services have, people move, people are redeployed, and they wanted to be brought in much earlier in the process. This has the support both of the CPS and the armed services, and so it's a recommendation to report and nothing else, so moved.
And there were no amendments, correct?
No, sir.
All right, the motion is to report 2279. Anyone in the audience to be heard on the matter? Committee members, if there's no discussion, record your vote on the board on the motion to report 2279. All members vote Dr. Van, light touch. Elvin Hodges and Edmund. Right there.
He's still showing closed. Technology.
Clerk says she'll take care of it, Edmund, so we've got you covered. Bill reports 21 to nothing. Delegate Bell.
Mr. Chair, the last bill we have in this batch is 2331, Delegate Perrottet.
331.
I'm trying to pull it up, but this provides the duties of the Community Service Board to provide pre-admission screening services to inmates incarcerated in a regional jail for the locality served by the CSP as a participant in such jail. It was the recommendation of the subcommittee to report. We have some amendment. I'd ask the staff to report the
Got an amendment, please.
Mr. Chair, the amendment is on page 1, line 28, after regional jail shall strike be required through the rest of the paragraph, ending with will be provided. Insert, review any existing memorandum of understanding between the Community Services Board and any other community services boards that serve the regional jail to ensure that such memorandum sets forth the roles and responsibilities of each community services board in the pre-admission screening process, provides for communication and information sharing protocols between the community services boards, and provides for due consideration, including financial consideration, should there be disproportionate obligations on one of the community services boards. Period.
Mr. Chair,
Everybody understands the amendment proposed, recommended by subcommittee without objection, was adopted by general consensus. Decided. Yeah, the amendments are adopted. Delegate Bell.
Mr. Chair, it's a unanimous recommendation of the subcommittee to report and refer up to appropriations, and I so move.
Discussion or comments from the audience on the motion to report and refer to appropriations? Any comments or questions from the committee? If not, committee members support the vote on the board on the motion to report and refer to appropriations.
Mr. Chair, that concludes this report. Thank you.
All righty. Thank you, Delegate Bell. We have some full committee measures. Delegate Collins, 1544.
Thank you, Mr. Chairman. I think there's a substitute. It's a line amendment.
Committee members, give your attention to House Bill 1544, please.
There is one line amendment to this bill. On page 2, line 64, after by the department at the end of the new language, insert provided such care is offered at the same facility.
All right, committee members understand the proposed amendment. Without objection, we'll adopt that amendment. Delegate Collins, please.
Thank you, Mr. Chairman. Ladies and gentlemen, the bill you have before you is to solve a fairly simple problem. If a diagnostic center wants to have diagnostic equipment within their building, they have to go through COPN, get permission to do so. Well, they might have 3 or 4 pieces of equipment. Each piece of equipment has to give a percentage of their services for free to the indigent population. What's happening in some locations and in some of these operations is they'll exceed their numbers on maybe 2 pieces of equipment, but 1 piece of equipment is falling short just due to lack of demand. But they still have to pay a penalty because that 1 piece of equipment, due to lack of demand, is not giving out as much services to the indigent population. So what this does allow an aggregate. It is no reduction in the amount of free services they are providing to the public. There's no reduction in the services they're providing. But what it does do is say if they're giving $100,000 in 1 piece of equipment, only $20,000 in another piece of equipment, if their net is $120,000, that would be their total indigent care for that year. They have met their burden. The alignment we put in was required to make sure that it would stay within 1 building, so that some organization couldn't open up 4 separate locations within a 100-mile radius and then use the aggregate of all 4. So it's because we want to make sure each locality deal with indigent services in that locality.
Dudley Garrett, question or comment?
Good question, Mr. Chairman. Dudley Collins. So if a health system A has 2 certificates, one is in County A over here, and the other's in County B. If County A is able to supersede their need and provide it, your intent is that they would not be required to maintain the effort in County B?
No, sir. Matter of fact, it's the exact opposite. If you have A and B, if A is providing a ton of services to the indigent population, but B is not, A does not get to share what they've done over to B. Because the idea, obviously, is, Delegate Garrett, is that you want to make sure that the reason we do it this way is so we continue to service the indigent population, the need for that particular community. So we want to make sure they're providing that need in that community.
Thank you, Mr. Chairman.
Further questions or discussion on House Bill 1544? Testimony from the audience on the matter? I hear a motion to report. It's been seconded. Delegate Levine, question or comment?
Delegate Collins, I certainly appreciate what you're trying to do. I just have a question. You said that they have to all be in the same building. Can you show me where that is in the code, because I didn't see that? Is that in
That's the line amendment. Yes,
That's
sir.
in the line amendment. Okay, that's why I didn't
Mr.
see it.
Chairman, I would tell the delegate that that's in the line. I'm sorry. I'm so used to working in courts, so I have to.
Oh, good. All right. Further discussion on the motion to report as amended. House Bill 1544 is before the committee. Please report your vote on the board on the motion to report as amended. All members voted who care to be recorded. The bill is reported 18 to 3. I've got to make up your minds here, folks. All right, 18 to 3. Committee members, please give your attention briefly to House Bill 1837. That's my bill. We have a substitute for that measure. I would ask the committee to adopt the amendment nature of a substitute. This is a bill relating to private certified preschool and nursery school daycare programs and licensure exemption. I will then ask, if there's no objection now that the amendment is properly before us, that we have that bill go by for the day, that we will take that matter up on Thursday, but I think that we should be able to take it up rather expeditiously on Thursday, that I'm not aware of any major opposition at this juncture, but again, not unlike an earlier bill, we'll get the language out there so everybody sees it well before we act upon it. Why does the department think they need the language? I'm just asking. Funny that is. Trust me. No. Delegate Murphy, 2046.
Thank you, Mr. Chairman. 2046, I have an amendment in the nature of substitute.
All right, could you tell us before we take action the difference between the original bill and your amendment?
Well, the original bill is a
For
little
full disclosure, this matter was heard at Subcommittee 3, and we conceptually agreed with what the substitute was going to say. The subcommittee did not see the actual language, so it's coming before you without recommendation from the subcommittee. All right, could you explain the difference?
In the original bill of 2046, the request was to require pharmacies to include written instructions for proper disposal of unused dispensed drugs, simply to meet the problem of these drugs being put in our water supply, which is really becoming a pretty big problem. And we had some discussions and decided it might work better if the bill then required the development of guidelines for provision of counseling and information regarding
So going first, the significant difference before was codifying what had to occur. The Section 1 bill is now just a directive to the Board of Pharmacy to go through the Administrative Process Act to achieve the patron's original objective, correct?
Yes, sir, you do that so much better than I do.
Without objection, we'll adopt the amendment nature of substitute before us. It's now properly before us. Discussion on the amendment.
Second.
We have a motion to report House Bill 2046 as a substitute. Is anyone in the audience to be heard on the matter? Will the committee takes action? No discussion from the committee. Members, record your vote on the board on the motion to report.
Thank you, Mr. Chairman.
Delegate Garrett, declare to be reported on the matter. Bill is reported 21 to nothing. Thank you, Delegate Murphy. Alrighty, we will jump back to subcommittee report. We're moving along well. Delegate Dickey Bell, who is the subcommittee chairman, is not here. However, we will go ahead. We've got most of the subcommittee members here. We'll go ahead with the docket. First, committee members, give your attention to House Joint Resolution 549. And there is an amendment nature of substitute for that matter. The significant difference before the committee takes action between the original resolution and the substitute, this resolution does not declare it a public health hazard, because the feeling of the subcommittee that is not within the purview of what this committee should be about. And secondly, it removes any and all gender references, as the premises of pornography is not gender specific in any way, shape, or form. Other than that, the general spirit of the legislation is still properly before the committee. If there's no objection, we'll adopt the amendment nature of a substitute for HJR 549. Hearing none, that's properly before us. We had extensive testimony in the subcommittee on the matter. The unanimous recommendation of the subcommittee was to report as a substitute. Is there anyone in the audience to be heard on HJR 549 before the committee takes action? I did want to acknowledge, hidden to my far left, which is the only time he's ever been to my far left, we have former member Delegate Jack Reed, who he and his wife have been very interested in this matter, and we appreciate their attendance here this morning. So the motion is to report as amendment nature of substitute. Committee members, record your vote on the board. All members voted who care to be recorded. The bill is reported 16 to 4. Alrighty, then, just working our way down the docket. House Bill 1420.
Mr. Chair, there is a substitute that was not seen in the sub.
Time to sneak one in on this.
Time, and it's.
Tell us the
I'm happy to
difference
explain
with the
it.
substitute.
Yes, sir, Mr. Chairman, the substitute will put it in line with the Senate version of this bill that Senator Sturban has. And what it does, it includes a couple of provisions that a lot of us saw last year, I think in Delegate O'Bannon's bill, about how they still need to be, we can't just let these facilities be built willy-nilly, they still need to be
So
certified.
tell you what, Delegate Pease, I'm Delegate Farrell, sorry.
He's my mentor.
Yeah.
Understood.
Can we let this go by temporarily?
I'm happy for that.
As we get into the COPN block, let's take them all.
That'd be
Committees with
fine,
their
Mr.
indulgence will take up all other matters that came before the subcommittee. and hold them for the latter part of the docket, take them all we want. Delegate Lingenfelter, your bill number, please, because I don't have it. House Bill 1999. This matter was heard extensively in subcommittee. The unanimous recommendation of subcommittee was to report and refer to appropriations. Doug Lingenfelter, since it's your bill, you want to give us a brief explanation?
Very
of the
brief.
measure?
Mr. Chairman, this basically sets up an office to help those people who are legally present in the United States move towards citizenship and the services that are available to them. This we think is a good and appropriate thing government should do to try to encourage people to become full citizens who are here legally.
Any questions of the patron on the matter? Anyone in the audience to be heard on this measure prior to committee action? Motion is to report and refer to appropriations. Committee members record your vote on the board on that motion. Matter is reported and referred 21 to nothing. Staff, we don't have any other patrons present. Other bills and sub 3 that are not COP. Committee, give your attention to House Bill 2092. Delegate LaRock. Do we have a sub? Straightforward. Subcommittee heard this matter and recommended 4-1 to report the measure. What the bill does is creates a review of the records and information in the application for public assistance process. And if the subcommittee, if the committee wants to act favorably upon the matter, then the motion should be, because we didn't have this information at subcommittee level, the proper motion would be to report and refer to appropriations, as there is a potential fiscal impact on the matter.
So moved.
Been moved, do I hear proper second? Second. That we would report and refer 2092 to appropriations. Discussion on the motion, or those in the audience to be heard on the matter before we take action? Many members record your vote on the board with motion to report and refer House Bill 2092. Matter is reported and referred 14 to 7. Farewell will be next. All righty, well, Delegate Farewell, back to you. That didn't take so long, did it?
No, sir. Mr. Chairman, if
We have the amendment nature of a substitute
Yes, sir.
proposed by the patron.
And this is
Without
after
objection,
yes, sir.
we'll adopt the amendment nature of a substitute.
Mr. Chairman, if the Medical Society, Mr. King, I don't know where you went, if you wouldn't mind, they came by to see me about some amendments that.
Do you want this to go by temporarily?
No, I don't think so. I mean, it's just very brief. I'm happy to have them just let people know it's from the bill last year that Dr. Van had. It's nothing new.
Yeah, Mr. Chairman, members of the subcommittee, essentially it's the permitting language that we had Delegate O'Bannon's bill last year that includes a charity care requirement with enforcement, along with registration with the Department of Health and appropriate accreditation and quality standards.
So, Mr. Chairman.
Any questions? Delegate Farrell.
Yes, sir. Speaking to that, I just thought it was fair to make sure that, yes, if we allow mental health facilities to be built, we should have, you do want some checks and balance on make sure they're accredited and whatnot. So I was fine with those amendments. The substance is still the same. This will allow mental health facilities to be built a lot faster without going through the burdensome process.
Anyone in the audience to be heard on House Bill 1420? Was not able to be at subcommittee?
Mr. Chairman, members of the committee, I was at subcommittee, however, this amendment was not before us at the time. We like the idea of including these additional provisions in the bill. Those were comments that we made in subcommittee to try to make sure that we have robust charity care conditions applied to psychiatric services. However, I will say we do want to take a close look at the language. If it tracks the language of Delegate O'Bannon's bill, we had some concerns about that, for example, which we've also discussed in subcommittee about different solutions for alternative complaints and compliance, and we make sure are closely enforced, monitored, and do ensure increased access to care for indigent and Medicaid folks. Thank you.
Any other testimony from the public? Committee members, any questions, comments? subcommittee recommendation was to report. Now we'll be doing that as a amendment nature of substitute, 1420. Committee members, record your vote on the board on the motion to report 1420. Let's go back. Delegate Edmonds. There, the bill is reported 16 to 5. Thank you, Delegate Farrell. Next, Delegate Hester. House Bill 22. Am I correct, sir? No, I'm sorry. 2101, my apologies. All right, we'll go by temporarily on 2101 because there are other amendments without the patron. We'll take those up. Committee members, 2225. Delegate Head.
Yes, Mr. Chairman. There were a couple of amendments that were introduced at subcommittee, but there is another amendment that we need to introduce.
Without objection, shall report the subcommittee amendments so we can act on those first.
Yes, hold on. Let me get to the bill. Sorry, I had to find it out. With two sets of line amendments, your first set are the amendments not heard in subcommittee. I'll do the ones.
Do the ones from subcommittee.
Yeah, from subcommittee first. Those are on page 5, line 282. After 54.1-2709.1, we're going to add who has been issued a certificate of public need pursuant to Article 1.1, section 32.1-102.1 et sec, period, close paren, of Chapter 4 of Title 32.1. The other amendment will be to add the same language on line 291 after for osteopathy.
Any questions on the recommended subcommittee amendments? Hearing none, we'll adopt those by general consensus. And now, Delegate Head, you had additional amendments you want to propose?
Yes, Mr. Chairman, I think, sir.
Sarah's going to read those.
I do, and there are, make sure I have all of them, there are 2 additional ones here. The first line amendment is on page 3, on line 174, after of the patient, insert for nursing home as defined in section 32.1-123, charity care means care at a reduced rate to indigents. The second amendment is on page 5, line 248. After and Medicare services, insert notwithstanding the foregoing, every nursing home as defined in section 32.1-123, for which a certificate of public need with conditions imposed pursuant to 32.1-102.4 is issued, shall report data on utilization and other data in accordance with regulations of the board. We will then move that last new sentence to its own paragraph.
All right, could you explain the effect of those amendments before the committee takes action? And I'll talk about it.
Sure, Mr. Chairman. The first amendments that were offered at subcommittee were simply because the classifications that we were identifying in that section, and the purpose of this bill is to define what charity care is and what it is not, and make sure that when we're collecting the data on how much charity care is being provided, that we're having a uniform standard across all these areas. When you're dealing with a couple of those professions that were identified in the bill, if they are not in a certificate of public need, then there's really not a need for them to be collecting the data. So we wanted to exclude those who were not in that in those first 2 amendments. The second amendment was to make sure that when you're dealing with nursing homes, the way that they define charity care and are regulated, CMS is regulating the hospitals, and you've got things that are flowing down from that, but that is not the case with nursing homes, and there wasn't any regulation for that, so the Department of Health needs to be there for them so that we're in the correct posture. It keeps, again, everybody utilizing the terms and the oversight that's already in place without us having to create something new.
Delegate Levine, question or comments on the amendment?
Not on the amendment.
Okay, if we could hold then Delegate Farrell, questions or comments on the amendment?
I'll wait for the amendments.
All right, without objection, we'll adopt the proposed amendment from the patron. Hearing no objection, they're adopted by general consensus. Delegate Levine on the underlying bill now as amended.
Yes, Mr. Chairman, I have a question for the patron. My question is, does this bill, HB 2225, does it place the same requirements for charity care on all providers, hospitals, physicians, clinics? Sounds like it doesn't. Is that right?
Mr. Chairman, this, for anyone operating under a COPN, if there's not a need for there being a certificate of public need for them to be operating, then no, they wouldn't have that requirement. But if they are operating under a COPN, then yes, it does.
Okay, and then I have a
Further questions?
Yes. The requirements for nonprofit hospitals, are these the same requirements that are under the federal IRS rules?
Mr. Chairman, I'm sure that I am qualified to answer that question.
Is there anybody who is? Not so much.
Okay, no further questions.
Further questions? Delegate Farrell.
Yeah, Mr. Chairman, and I'm looking forward, you may have already mentioned, but maybe for the patron, how does, when we're calculating shared care, you're not going to be doing it based off charges? Are you doing it based off charges or costs? Or, because there's a difference. I just want to know.
Mr. Chairman, if I can respond to that, the basic premise here is that, first of all, a hospital is going to need to define before they provide services what charity care is. And then charity care, as they define it, would be everything that falls into that bucket. The real purpose of this is to, as you're collecting the data, make certain that if there is bad debt, which is going to be care that was provided to someone who wouldn't qualify for their pre-established conditions for charity care, but just simply didn't pay their bill, that really isn't charity care. That's bad debt and needs to be a write-off, and it should fall into a separate bucket. So when you're looking at charity care, you can't just take all of your bad debt and roll it over in there and count it as this is the percentage that we've done as charity care. We have those defined before we get to that point. And then also it further stipulates that the bad debt, that before you go into aggressive collections on there, you also have in process a mechanism to evaluate to see if those people who didn't pay their bill might actually have qualified for charity care, in which case they would be over. But we set the criteria for charity care beforehand and make that clear.
Yeah, Mr. Chairman, I think I agree with all that. I think that's great. What I don't want to be able to do, quite frankly, is allow a hospital to use a charge number as a charity care number, because quite frankly, that can inflate dollar amounts when that's not the actual cost. Because charges, the only time, from at least a little bit I know, when a charge master is a charge master, but rarely ever does a hospital actually get reimbursed, or does the cost match the charge master. So if you allow a hospital to say, I did $5 million in charity care based on my charge master, I just don't think that's a good way to do it, because the charge, for instance, an MRI, the charge may be $5,000, but usually they're only getting paid $800 by a healthcare provider, which kind of insurance company they have a contract with. So I just want to point that out, because I think you're leaving a gaping hole if you allow hospitals to use a charge master to say how they're doing charity care going forward.
Would you agree? I think that was a question. All right. Any further
Mr. Chair?
questions or testimony? Yes, sir.
So would this bill allow them to use charges as a way to calculate charity care?
Mr. Chairman, again, that's the first time that question has been asked of this entire part of the process. And
anybody
that might be able to address that, would be.
I'd like to ask him, Mr. Chairman, back there.
Phone a friend.
Chairman, members of the committee, Brett Rollins, Virginia Hospital Healthcare Association. As we read the bill, I believe that it defines charity care at a standard of
Mr. Chair, if you would mind, council, where does it say that? I just want to make sure I got that. Is there, what line or where is that in the bill? Is that code section?
Good morning. Come on down.
Mr. Chairman, I believe that's roughly 246. 47.
Thank you.
All right.
Perfect.
Further questions or comments?
Thank you.
Anyone in the audience to be heard on House Bill 2225? The subcommittee recommendation of the pre-amended bill was to recommend reporting 4-1. And I do not have a letter on this matter. So, the motion is to report as amended, House Bill 2225. There's no further discussion or public testimony. I'm looking forward to a vote on the board on the motion to report as amended. All members voted, declare to be recorded. The bill is reported 14-7. If we could take up House Bill 2183, Delegate Yost.
Thank you, Mr. Chairman. It should have been a substitute. Sarah gave it after the name. I don't know if she still has copies.
Could you explain what the substitute will do as it's being distributed to the members?
Thank you, Mr. Chairman. The substitute creates a Section 1 bill, convenes a work group to look at, to get stakeholders together to develop a common process for ensuring a seamless provision of appropriate Medicaid funded services upon release or entry into society for inmates. This bill will lead to a process by which inmates are basically teed up to be enrolled into having appropriate services seamlessly upon release.
So the effect of the substitute, the original bill would have codified that this practice would have to begin, and the substitute creates a Section 1 matter where DMAS will look at the issue and let us know how big a problem it is before we do anything long and short.
We can have a conversation before.
Without objection, we'll adopt the amendment nature of substitute. Hearing none, it's properly before us. Is there anyone in the audience to be heard on substitute language for House Bill 2183? We have someone coming forward. But before they present, yes, sir.
I just want to make sure I'm clear, because there's a lot of stuff flying, Mr. Chairman. That is, lines 20 and 21, the work group shall identify and take steps, such steps. Does that not create an action upon them? Not just simply convene a work group and discuss it, but shall take steps as may be feasible. I mean, nothing harm, I'm just trying to understand it, Mr. Chairman.
Were you proposing a potential amendment on line 21?
Well, Mr. Chairman.
Between and take, may take steps as may be feasible?
Well, Mr. Chairman, then perhaps if it's more appropriate question to the patron. So, Delegate Yost, is it your intent that DMAS shall convene a work group to look at the process whereby today, when someone is incarcerated, they lose their Medicaid and they have to reapply when they come out? Or is your intent that, in fact, when they go into jail, they're going to keep their Medicaid, and you want this work group to tell us what the impacts of that will be?
I think Ms. Bosher from NAMI will better answer that question.
Hi, good morning, Mr. Chairman.
Good morning.
Good morning, how are you?
Fine, thank you.
Members of the committee. I'm Sarah Bosher on behalf of NAMI, National Alliance of Mental Illness. It's my understanding that this bill would put a suspension on the benefits so that when the individual who is incarcerated is getting ready to be released, they are teed up, and once they are out, they don't have that lag time and that wait to receive the benefits that they need once they are out.
All righty, thank you, Ms. Bosher. Further testimony on the matter?
We support the bill.
Without making it a may and leaving it as a department shall. Okay. Thank you.
Mr. Chairman, committee members, Jeff Gore, on behalf of a number of regional jails that our firm represents, including Riverside Regional Jail down in Prince George County. In 2013, you all collectively as a body directed the state to start doing this for DOC inmates. Subsequently, I think a year later, you all directed the state to start doing this for local and regional inmates. This is current law. This is a process that the state agencies are already looking at. And I think the benefit of this legislation is it prioritizes this. Right now, the state, frankly, the state and local counties are leaving to federal money on the table because this process could be better. And not only is it a money-saving issue to draw down eligible funds, this is existing Medicaid, has nothing to do with ACA at all. This is pre-existing federal law. And not only does this process, it has improved, help save the state money, but ideally it helps on issues like recidivism if you have a seamless re-enrollment. So that, and that's all you're doing is directing the state to do what you've already told them to do through budget language. I think this sense of this a clear priority would be very helpful.
Thank you, sir. Further questions or comments from the public?
Move report.
Committee members, the motion is to report. Anyone else to be heard on the matter before the committee takes action? Any further questions? You're here.
Chairman Vanavla, I'm the Chief Deputy Director at Medicaid, and while we have no position on the bill, I would say that a work group is probably not a bad idea. It's a complex issue. The department has been working on it. We have made some progress, but it's complicated and it's not well understood, and it needs to be worked through.
So you do have a position or you don't?
All right. Any other testimony? Committee members on the motion to report as a substitute, 2183. Ready to vote on the board. All members voted who care to be reported. The bill is reported 22 to nothing. Thank you. Delegate Bell, we have taken up most of the matters from I believe there are two measures before us still. The first, I think, would be three measures. I'm sorry. Delegate O'Bannon's problem.
Thank you, Mr. Chairman. I apologize. I'm still trying to figure out how to be two places at once. House Bill 2337.
Committee members, House Bill 2337. And there is a substitute that has been distributed. It is a recommendation of the subcommittees without objection will adopt the substitute. It's now properly before us.
Mr. Chairman, House Bill 2337 creates a two-phase process to sunset Certificate of Public Need, COPN requirements for many categories of medical care facilities and projects, with the requirement for a Certificate of Public Need for all medical care facilities other than nursing homes, rehabilitation hospitals and beds, imaging centers, organ and tissue transplant services, certain open heart surgery services, certain neonatal services, and certain medical care facilities located in a locality with a population density of at least 200 people per square mile, as reported by the United States Bureau of the Census in 2010. That's continuous with at least one other locality of such population density, or has a population of at least 75,000 people. Repealed effective July 1st, 2017. And imaging centers repealed effective January 1st, 2018. The bill also creates a new permitting process for categories of facilities and projects exempted from the Certificate of Public Need process that requires the Commissioner of Health to issue a permit, but requires the Commissioner to condition a permit, A, on the agreement of the applicant to provide a specified level of care at reduced rate to indigents, accept patients requiring specialized care, or facilitate the development and operation of primary medical care services in designated medically underserved areas of the applicant's service area. And B, on compliance of the applicant with quality of care standards. The bill also eliminates regional health planning agencies, makes numerous changes to the COPN process for facilities and projects that will be subject to the requirement of a certificate. The bill contains technical amendments. Mr. Chairman, that summary, I believe, is from the original bill, and I don't know if everything is still applicable in the substitute or not.
Dr. O'Bannon, did you want to elaborate more?
Substitute made several changes. Among them, we changed slightly the definition of the localities. You'll see in the substitute, we actually added a definition of Health Innovation District. It adds to the list of descriptor of the localities that may be affected. Additionally, a locality that does not meet the criteria previously stated, but that is contiguous to a locality that meets the criteria and has adopted an ordinance opting to participate in the health Health Innovation District.
Dr. O'Bane.
So, thank you. So, you all know this is something we've been working on for a while. This year, we have tried to narrow this bill a little bit and protect the rural hospitals who need protection. So the definition you see here, and it's actually in the bill on page 28, it defines a health innovation district, and it's done by population basis, and it also provides that if there's a community with 75,000 people but less than 200 per square mile, that they can also join in this. It also provides for a locality to participate. So it basically narrows it down to the populous areas, which was, I think, the concept that we tried to do last year. So that's basically the change.
And one other change is the substitute eliminates the requirement for certificate for psychiatric beds and services regardless of location in year one.
Any questions on the matter from the committee? Anyone in the audience to be heard on House Bill 2337 was unable to be at subcommittee process after an extensive hearing at that stage. And so the committee knows the subcommittee recommendation is to report as amended. That will be the matter pending before the committee. Delegate Hodges. Delegate Hope.
We're good. Delegate Hope, that's good.
Okay, you went away.
Well, thank you, Mr. Chairman. And first, thank you, Dr. O'Bannon, for trying to really work over this over the course of the year to help to assist the rural localities and the rural hospitals. But I would like to maybe address, even though it's attempting to do that possibly because many of these rural hospitals and health systems are still, within 25, 35-minute drive to the larger areas with the commute rate of, people working in those areas. How, the bill really attempts to address that.
Will you repeat that question?
Sure. Really, and first, thank you for trying to work and protect the rural hospitals and rural localities. But given the urban crescent and the commute rate of some of our localities into that urban crescent with, some of, perhaps my district is over 70% of the population, and the folks that are left behind are basically the lowest wages in the state that really don't have access to, the outlying areas. That would be, one of my concerns, and if you could address that.
Yeah, thank you very much, Delegate Hodges, and I believe you voiced that concern last year. And what we've done with this bill is to try to satisfy the concerns of some of those rural areas, but still allow for some real competition in the populous areas where I think we have opportunity to do real reform and help all of our constituents get health care at a lower price. And so I think the definitions here do it a little differently, but they narrow it down to the areas where there is, in fact, a lot more competition amongst these healthcare systems. And it also provides for a locality to opt in, like certain localities who might want to have benefit of some of these opportunities for competition and some of the services which might be more available if we did this.
Further questions? Delegate Hope.
Thank you, Mr. Chairman, and we won't relitigate what has happened in years past, but I think something that has changed since last year is Congress is expected to repeal the Affordable Care Act maybe as early as March. Last I've heard is that the House is supposed to vote on a package through reconciliation that first week in March. And I'm curious if we're in that situation. I've heard reports that nearly 700,000 Virginians would be uninsured under that scenario, just outright repeal. And I wasn't at the subcommittee hearing last week, but I'm wondering has there been any analysis of that? Would that occur? What that kind of uninsured would mean to facilities that have to care for these uninsured, and what this would do to their ability to continue to care for them?
I certainly don't want to predict what's going to happen in Washington, but I think when you get into negotiations, it's entirely possible that the hospital industry could wind up being better off since they gave up $713 billion in the original ACA deal. So I think that doesn't necessarily pertain to
I know that there is a committee that's going to be looking at the Affordable Care Act during the off-season after we adjourn. Is this something that we could send over to them to take a look at and monitor as the situation warrants? And you might very well be one of the people that are on that group. Would that be a better alternative, given that the uncertainty that we have?
I do not think that would be a better alternative. I think we have an opportunity now to do some reforms in Virginia which will help all of our constituents have better ability to get health care at a reasonable price.
Thank you, John.
Any further questions or discussion on House Bill 2337, amendment nature of substitute?
Let me just make a comment here. I hope Delegate Stolley has a bill. It does some reforms a different way. I really hope we will report both these bills. They both will need to go to appropriations because they do have fiscal implications. But I think this would continue the discussion. There's a discussion in the Senate. And I would just appeal to folks that we go ahead and recommend reporting this and referring to appropriations.
And so the full committee and the audience understands parliamentarily you cannot vote out two measures that are in conflict. And we've examined both this and Delegate Stolley's bill, and they are not parliamentarily or procedurally in conflict. They're just basically different options to try and affect a similar goal. So that issue should not be raised. The motion would be the recommendation is to report and refer to appropriations 2337. If there's no further discussion, members record your vote on the board on the motion to report and refer to appropriations. Delegate, the bill is reported and referred on a vote of 11 to 10. Delegate Stolley is next, but Delegate Bell, if you'll explain reporting for the subcommittee.
Mr. Chairman, I believe there's a substitute for House Bill 2458.
Substitute has been distributed without objection. We'll adopt the substitute recommended by the subcommittee. It's been properly before us. Delegate Bell.
Mr. Chairman, rather than try to make a guess here on changes that might have taken place, I will ask the patron who's seated right beside me to summarize for us if that's okay.
Delegate Stolley, please.
Thank you, Mr. Chairman. Sarah, I believe there's a line amendment.
There is a line amendment to the substitute on page 13 of the substitute, line 342. Following the date there, November 1, 2017, insert or as soon as practical thereafter.
Committee members understand the proposed amendment. Without objection, we'll adopt that amendment. Delegate Stolley.
Thank you, Mr. Chairman. Without taking a lot of the committee's time, we have talked about COPN extensively. I think everyone at this committee knows pretty much what's going on. The bill that I present this year is similar to the bill I presented last year. It is the recommendations of the year-long working group that was put together with all the various stakeholders across the state. That was insurance companies and individual physicians in practice and health systems, but most importantly, business leaders from across the state. They came up with a set of recommendations on how we should move forward with COPN, how we should evaluate COPN moving forward, and specific analytics that should be put in place that we use to make intelligent, informed decisions on the impact that repeal of COPN would have on this state. This bill moves all those suggestions forward. Additionally, within this bill, we repeal those aspects of the COPN that we all agreed to last year. And that includes lithotripsy, magnetic source imaging, nuclear medicine imaging, and obstetrical services. We also agree with Delegate Farrell that his repeal of the psychiatric beds and have included this in this COPN legislation. Additionally, we have repealed COPN for ASCs and operating rooms in those districts where there is a documented need for additional access. So this documents in those health planning districts where there is an over 80% utilization of operating rooms, that there would be permit granted to build future operating rooms. This differs from Delegate O'Bannon's bill, which tries to do it based on population, and you can have a population that is dense, but has a lot of excess capacity. And you certainly wouldn't want to introduce more capacity into an area that's excess capacity. This uses specifics that are currently in the state medical facilities plan on determining a need, and then bases those permits on need. Mr. Chairman, I'm happy to answer any questions.
Delegate Hope, question or comment?
Thank you, Mr. Chairman. Patron, on lines 216 to 222, that's the language where we establish this 80% threshold. And I want to try to operationally understand how this would work. Can you tell us what data would be used to determine whether the 80% threshold is met? How do you get to that? How do you get to that number, calculating it?
Yes, Mr. Chairman. I do have it here. So, Mr. Chairman, I would draw the attention of the committee, and I know that you don't have this in front of you, but that our current state medical facilities plan has specific standards for determining just this type of thing. It's based on the formula, based on future operating needs, the utilization of individual ORs, and I'm happy to provide a copy of those standards to the member. It is the same standards that we're currently using within the state medical facilities plan, so this is not new technology, it's not a new formula, it's the same process for determining what an actual need is.
Follow-up question, Mr. Chairman.
Further question?
So let's say that I'm a hospital and I've met the 80% threshold. Am I safe? Or if I add a few more operating rooms online, that might bring me down to 70%, do I suddenly get my certificate pulled from me?
So, Mr. Chairman, Delegate Hope, this is not based on individual hospitals, this is based on health planning districts. So it would be a calculation of 80% within that health planning district. If we exceeded that 80%, and as the bill also calls for, regular updates to the state medical facilities plan, annual report out to the General Assembly. So this year, we calculate that in a certain health planning district, that are greater than 80%, a permit can be issued within that district. So, or 2 permits can be issued, or 3, whatever would take the 80% to less than 80%, and that's a future 5-year look forward on that, based on that calculation in the state medical facilities plan.
All right, follow-up question, Mr. Chairman.
Further questions?
So you don't, in the legislation, you don't include requirements to accept Medicare and Medicaid and TRICARE. Is there any reason why you exclude those?
Mr. Chairman, Delegate Hope, yes. So I think, and we've had this discussion before, I think that's really a double-edged sword. So if we, as a General Assembly, start mandating to individual providers that they have to take the state-funded health plan, it is incentive for us to underfund the state plan. So if they're required to take it, then we can cut Medicaid reimbursement to any level that we want to as a cost-saving measures. This keeps that competition in there. If we included that, right now we're at 64 cents on the dollar. We could drop to 50 cents on the dollar, or 48 cents on the dollar. The only measure we have for the state to keep pressure on that is an access issue that's monitored by the federal government.
Delegate Sickles.
I just wanted to ask a question about the 80% rule. Help us talk about why wouldn't, if we adopted this, just be a raise in each district to get the next ambulatory surgery center? Because the next one would drop you down below 80%. So the first in line is going to get the next one, and then you make it below the 80%. You don't get another one. Is that the way it should work?
Mr. Chairman, Delegate Sickles, although not spelled out in the legislation, I think it probably needs to be spelled out at some point in this process. What I would envision is the process, and we do talk about charity care and the need for charity care. Within this bill, we set a minimum standard of charity care that is consistent within the health planning district. If we determine in the state medical facilities plan at the 80% level, future 5 years, that we're going to need to have 2 or 3 more ORs, and we have 10 applicants for the ORs, I would like to see those applicants compete on the amount of charity care that they're providing. So if I have 10 applications for those 3 positions, and one comes in at 3%, one comes in at 5%, one comes in at 10% for charity care, I want the 10% charity care, I want to get that permit.
All right, I've got one more in the queue, and I will just make the observation, it's 5 minutes after 11, caucuses begin in 10 minutes. But we're going to take action on this matter before the committee rises. Delegate Farrell?
Move to report as amended.
Subcommittee recommendation is to report and refer to appropriations.
Right, report refer.
So any further discussion on the motion to report and refer to appropriations? Anyone in the audience to be heard on the measure before we take final committee action? If not, committee members record your vote on the board on the motion to report and refer to appropriations. All members voted who care to be recorded. Bill is reported and referred 14 to 8. Delegate Head, would you be adverse to having your matter go live for the day and on the docket Thursday?
If that's what would be in the best interest of the committee, I'm happy
Looking
to do
at
that.
the time, I think that's probably where we are. That means we got through most everything. She's not here. But we're going to hear Thursday. She's not here. There's her question. So, committee members, stay tuned for